As a young lad growing up, I had my mother sick and bedridden for 10 years. She couldn't come out of the house. And I happened to be with her in the hospital, and this really made me to lose almost 2 years of my regular schooling. After she has been attended to the teaching hospital in Enugu, to no avail, they are referred to St. Charles Borromeo Hospital. And at night, the doctor attending to her, a white man, came in with another black doctor, a Nigerian medical doctor training in Germany as a surgeon. So he now told my mother that she needs an operation. So he came in, had the surgery on my mom, and the long-standing 10 years problem was resolved. So that was when I then was convinced that if I will further my education, it will be in the medical profession. I was determined that if I will study medicine, I will be a surgeon. And thanks to my parents, because they have seen the zeal in me, so they now sent me to Rome in Italy to study medicine. And throughout my stay in Europe, it has been my dream to replicate and repeat the same thing that happened in Borromeo Hospital. I've been visiting Nigeria often and on to help in different medical missions, and I decided to establish one to give a standard medical treatment to my fellow Nigerians. So here we are today at the Port Harcourt European Hospital. To the grace of God, it's a success story. As a surgeon and a general surgeon, in putting up this facility, we work towards having it as a main surgical hub in Rivers State. And in fact, our theater is a state-of-the-art theater. Other surgeons from different parts bring in their patients here for complicated surgery like maxillofacial and so on and so forth. So most of the time we see people rushed inside here with broken bones, internal hemorrhages that need intense and emergency treatment. On one evening, I saw a vehicle rushing with a patient. The patient still conscious, but hypotensive. When we brought the patient in, we immediately rushed the patient to our emergency room to resuscitate her. Given that the patient was losing so much blood, the challenge was, how do we replenish this blood? How do we get instant blood transfusion? So good thing, I remember there's a company that did tell me that they will be there for us 24/7 if we need blood. And what I did was to pick up a phone, and they said, within the next 30 minutes, we will get you the number of units of blood you want. So go ahead with the surgery in the theater. We promise you that while you're in the theater doing the surgery, the blood will be there. But we got this blood, 2 units within 30 minutes, and another 2 units within the next 1 hour. Thanks to Life Bank, that lady's life was saved. Usually in life, nothing good comes easy. But the problem is that we are having a massive brain drain, the so-called Japa syndrome, which is really hemorrhaging the country. But I will still encourage the young people to remain in Port Harcourt. Do not lose faith in our state. Do not lose faith in our people. Our people need good health care. And it's you and you alone as indigenous doctors that can be able to fill that gap and give our people what they want.